Hi, could that pain in the lower right side of your tummy be appendicitis? Have you had appendicitis before? So today we're going to discuss about appendicitis. We're going to go through symptoms and how it can be managed. Alright, so my name is Joyce and I am a physician associate here in the UK and I work in general practice. So in this video I'm going to talk about appendicitis and what things you need to look out for in order to be able to get seen very quickly, because it is a medical emergency. So stay with me. We are all born with an appendix. So sometimes that can be inflamed and that would cause the symptoms which I am going to talk to you guys about. So the pain with regards to appendicitis is on the lower right side of the tummy and it's excruciating pain. That's how people would describe it. It's not even pain to joke about. It also causes loss of appetite. You would also notice that you would have constipation or diarrhea. So either one of the two. And this is a very acute presentation. What I mean by acute is it's very quick. It just happens suddenly. Within a few hours, you start having the symptoms. So this is not something that builds up over months. This is very sudden, very quick, within hours, and you need to be seen at the hospital essentially. So let's go through what puts you at risk of having appendicitis. So usually with appendicitis, most people who would have it are males between the age of 10 to 30. So obviously that's not concrete. You might be below or above that, but generally that is what we're looking out for. Males between the age of 10 to 30 are most likely to have that inflammation of the appendix. One other thing with appendicitis, you would notice it. You would also present with a fever. Remember, this is inflammation of the appendix. So having a fever would be one of the signs and symptoms for that as well. In terms of, okay, so you have presented, hopefully at this point in time you have gone to hospital. If you are suspecting appendicitis, you've got the symptoms that I mentioned earlier, then head straight to the hospital because it is a medical emergency. What they would do at the hospital, they would assess you, they would examine your tummy, they would check for what we call rebound tenderness on the tummy. They would also check with blood tests whether your inflammatory markers are raised. You would also have an ultrasound scan of your tummy. Although an ultrasound scan is not definitive, it doesn't exclude appendicitis because sometimes it doesn't show on the scan. So the scan that actually confirms appendicitis would be a CT scan of your tummy, of your abdomen. So the clinicians would do those tests, and then in terms of management, you might be wondering what's the management. The obvious management for this would be to remove the appendix. That is the ultimate management for it. So in the meantime, they might, give you medication to help you with pain relief and things like that. But ultimately, that appendix needs to come out. And before you start asking, you can live without the appendix. You can have the surgery and still go back to your normal life. Obviously, you need to adjust your diet and things like that, especially following the surgery. But that's not something that cannot be executed and done without any further. So in terms of monitoring, once you've had your surgery, which would be a laparoscopic surgery, so it's not an open surgery, it's a laparoscopic surgery. Once you've had that done, you will be discharged with information on how to look after yourself. The main things that your clinician would be worried about would be infection. So that's what we want to avoid. So any infection on the site where you've had the laparoscopy incisions done, we need to monitor that. And obviously you would be also discharged with pain relief as well, because you would need that if you've had the surgery. But you should expect to recover and go back to your daily life. But it's very important for you guys to know what symptoms to look out for. So that's why I do all these videos, guys, so that you know when to go to A&E or ED, depending on which country you go to, and when to go to your family doctor or general practitioner. So if you have excruciating pain on the lower right part of your tummy, excruciating pain, sudden, you start having a fever, you start having nausea, please, 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 and the fever would be quite high temperature, I'm talking about 39 point something, you know, please, please go to A&E and be seen. Very, very important. I do hope this has been helpful, guys. If you have had appendicitis, you've had your appendix removed, please share your experience with us so that other people can also benefit and also learn from real life experience. Otherwise, guys, I will catch you on another video. I do hope you found this informative. If you have, then please subscribe, like, and share with others so that we can start a movement where we are just educating one another in terms of our health, so that ultimately we can be as healthy as we could possibly be. And as I always say, where there is health, there is hope. See you next time. Bye-bye.